This show is not a discussion about dengue. It's how dengue affects your life. The dengue epidemic, it's rearing its ugly head back into our waters. It's time for you, the parents, the children, anyone. Lift up your pitchforks, light your fires, protect your children. This is Good Morning Sri Lanka. I'm your host, Jason. Today we have our first guest in the studio is Dr. Nalin Kidulwata. Good morning to you, sir.
Good morning.
Thank you for being on the show. We really appreciate it. And we're focusing today on dengue itself. Now, this is obviously going to be a very basic question that I'm going to ask you for the viewers at home. What is dengue?
Yeah, that's actually a very important question. So dengue is basically a viral disease caused by 4 different types of viruses. The importance is this virus is transported or transmitted to the human by a mosquito. So there are 2 things in the transmitting of this disease to humans. So it's a viral disease, but there should be a mosquito to take this virus from one person to another.
All right, and this mosquito is called the...
Yeah, this mosquito is called the Aedes mosquito. It's a special type of mosquito. It can transmit dengue virus, but not the other mosquitoes.
Okay, now from what I've understood is dengue could affect anyone of any age, if I'm correct, but it affects children under the age of 14 the worst.
Yeah, that's correct. So dengue can affect you and me or anybody, but the thing is the worst problems arise less than 14 years. So that's why. So it's basically a disease which can affect the children, not only the children but adults, but the most severe in children.
Right. Now I also understand that the symptoms you could actually see what the symptoms are after 3 to 14 days after the mosquito bites you. What are the symptoms when it comes to dengue?
Yeah.
And I think we have a few symptoms cards on screen right now, but please let us know what the symptoms are.
So basically what happens is when the mosquito with the virus bites you, you get the virus. So just because you get the virus, you will not get the symptoms, so it will take some time. So 3 to 14 days, we call it an incubation period, or before you get the symptoms.
Okay.
So
right. So, but the symptoms, which usually, as you can see on the screen, which usually begin from 4 to 6 days after infection and last for up to 10 days, may include sudden high fever, severe headaches, pain behind the eyes, severe joint and muscle pain, nausea, vomiting, skin rash, which appears 3 to 4 days after the fever, apparently. So you get a fever out of this as well, and there's also mild bleeding and yeah, bleeding gums. How do you take in all this? Because I know that, like, for example, there are many other diseases or sicknesses that have these same symptoms.
Yeah.
How would you find the difference between dengue and, some other sort of disease?
In fact, it's a very difficult task in the first few days. So first 2 to 3 days with fever is basically any type of viral infection, any type of viral fever. But there are some hints to show that this could be dengue. So as we have seen earlier, so these are the pain, we call the dengue like break bone fever.
Right.
The bones are like breaking, so it's severe myalgia and severe pain all over the body. So that's very common. And pain behind the eyes and headache, and then the tummy pain and vomiting, severe vomiting, they are common. But I must say that all these symptoms are not in each and every patient. So just because you don't have these things, you cannot say that I don't have dengue. So any fever which lasts more than 2 days should be considered as dengue unless proven otherwise.
Right. Wow. That's thank you, doctor, for that. All right. So what we just showed you before was dengue fever. Now we have a dengue hemorrhagic fever. Could we have that on screen, if you don't mind? These are the warning signs that you get out of the hemorrhagic fever in dengue. But speaking of which, what are the symptoms? Oh, there we go. Severe abdominal pain or persistent vomiting, red spots or patches on the skin, bleeding from nose or gums, vomiting blood, black tarry stools, drowsiness or irritability, pale, cold or clammy skin, and you also have difficulty breathing. Is that right, doctor?
Yeah. They are correct. So I must say that dengue fever and dengue hemorrhagic fever are completely two different diseases. So dengue fever will not become dengue hemorrhagic fever.
Right.
So the danger in dengue hemorrhagic fever is that we call it has three phases. So first we call it the febrile phase. That's the main symptom is fever. So we discussed with the fever you can get this body aches, vomiting, abdominal pain, headache and all these things. This lasts for about 3 to 5 days. But after that is the dangerous period. So we call it critical phase.
Right.
There the fluid inside your vessels will leak out mainly to the chest as well as to the tummy. So then only you will get that the hemorrhagic manifestations like bleeding from various places, and child will have they are ill. So usually what happens with fever is once the fever is not there, when the fever is settled, they are well. They play, they go back to the normal lifestyle.
Right.
But in dengue hemorrhagic fever, when the fever subsides, the symptoms or the symptoms will persist.
Okay,
so
this
they
is like
were
the worst
ill.
version of it.
So that's the danger. So we have found several children or several parents, because the fever is not there, they are happy. So okay, so now fever is not there, so whatever the disease is now getting better, but that is not true in dengue. So then only you start problems. So fever is subside after about 3 to 5 days, then you start this leaking phase. With the leak you will get the severe symptoms or the bleeding manifestations and all.
All right. So for those of you watching at home, also, like, this had happened, doctor, like you said, it had happened a lot of times. It's never really gone down in Sri Lanka, has it? But people are taking, they're trying to prevent it now, and there's a few penalties that have come up by the Act number 11 since 2007. The minimum mandatory fine will be increased by 5,000 rupees. And I've heard in some cases where it's gone up to 17,500 rupees. But also, like, the police official in charge of Sri Lanka's Western Province, Senior Deputy Inspector General of Police, Anura Senanayake, says that the operations to arrest and punish people who will contribute to dengue mosquito breeding will begin on June 8th from the Western Province. And I think that is great. I think there's finally action against this thing. Well, Doctor, we'll go into a quick commercial break and we'll be right back with more Good Morning Sri Lanka and more on dengue. We're here back again with the good Dr. Nalin Kitulwatar on Good Morning Sri Lanka, speaking about the dengue epidemic in Sri Lanka. And we also have a new guest on our show, an entrepreneur, a sportsman, a sports nutrition consultant, and above all, a father. We have Talavu Alelima in the studio.
Hello.
Good morning to you.
Good morning
and
to you.
Good morning to your three wonderful boys, Jonathan, Joshua, and Jason. Jason. Jason is the little one over there, the one who can't sit. How are you guys doing? How's the morning feel so far?
Excellent, thank you.
All right. So Talavu and his boys, they are survivors, if I'm correct, of dengue. Doctor, and you know these patients very well. Tell us about when they came over to you and you saw the kids in their state. What did you think?
So as I told you, so I'm working in medical intensive care unit of the late Rijaya Children's Hospital. So first time I saw this kid, I think a few days he was treated outside.
Okay.
And as most of the kids, so he was severely ill. So one thing I have mentioned that we call in dengue, there are some high risk categories. So one is less than 1 year. So he was one of them.
All right.
He was five months when he got this disease. And from the beginning we knew that we will have problems.
Okay.
So not only that, when he was admitted to our unit, his several organs had problems, namely the liver, kidney and lungs. He was having difficulty in breathing as well. So I think I have explained you in detail when I saw the child first time. So the consequences, what could happen, what we are going to do. And so our task was to look after these damaging organs not to damage them further. So I have a very good team, and so they are trained by myself as a few others, and we could be able to do that.
Right. However, now you tell me, this is one of the worst cases of dengue you've seen yourself on your son Jason. Tell me from the story from the beginning. Where were you when you first saw the symptoms of this dengue in your son?
Yeah, we were actually in Matale. We were on holiday. It was
Right.
around April last year, and then suddenly Jason started to get sick, very sick and groaning, and I mean it was going on. We were trying to pacify him, but nothing would pacify him.
Right.
And then we found the fever starting to climb. I mean, he was weak. He was not responding easily. I mean, he was just staring at us, and sometimes he would stare through us. And when that was taking place, we realized that we had to show a doctor, and then we kind of took on the first day
Right.
of fever to a doctor in Kandy. And then they addressed the problem, thinking that it was a normal flu. But by the second day, Jonathan, my second child, also got fever.
Right.
At that point, I realized that we were too far away from any kind of medical help, being a good 100 miles away. So we kind of headed back to Colombo. And by that evening, we realized both of them were very sick. And that's when we decided to address the dengue, I mean, just to address the fever issue,
Yeah.
and started taking the blood tests.
Right.
And within hours of admitting Jason, his count just dropped drastically while we were at a private hospital. And after a while, they were struggling to manage him by about 2 in the morning, and that's the point when they had to rush him to the Lady Ridgeway Hospital. And he didn't have more than, I think, 24 hours. There was a battle. I mean, the first 24 hours were, I mean, doctor could explain much better
Yeah.
what happened from there on.
Before we get into that, doctor, the common mistakes, now you went from encountering physician to physician to physician.
Yeah.
The common mistakes that you actually had to go through, what do you think you could have prevented, like, by going to these, for the parents watching at home, so that they know the next time they go to a doctor, they'll know to do the right thing straight first?
Yeah, I mean, the lack of knowledge of how to really address it and even to identify the problem.
Yeah.
I mean, it's always you think that it's you hear about dengue and then you think it's somebody else's child or something like it. It never dawns on you that your child also can get into trouble.
Yeah.
And when it does happen, you somehow didn't pay attention to the important information, like now that's been done. And then you have issues where you neglect certain signs and you don't know the signs. And then you then make some decisions on your own also, because we are used to sometimes treating ourselves for the common, thinking it's just a flu. We used to do that, many years ago, and kind of try to ignore it. But the situation is very risky at this point, and we need to go. I mean, one of the things that I got hold of through this process was the dengue antigen test,
Okay.
which really helped me identify him in the first day itself,
Right.
that he also had it. So there are certain tests that really helped us identify it much earlier, and being very watchful, I mean, the first few days is a very important part that we parents must do
Right.
to make sure that the kids are okay.
As you might have noticed, people watching at home, Jason's actually all good now, all better. He's actually running around. We're trying to grab hold of him, but he's got so much energy. He's running. Jason, you're over there. All right, Jason's running around the studio. All right, he'll be back with us. Doc, now this goes another one to you. What's the procedure? A child has a fever. When should parents start to worry? And what's next from that point?
Yeah. So